Good morning, my name is Casey Fleming, and this is my persuasive speech. The way Americans define health care is changing rapidly, but as time ticks by, sick people are still going without proper treatment, and wounded people are still going without care. It is imperative that we change our system now, or countless more lives will be lost due to their inability to pay or their lack of access to proper care. As a student nurse, I've just begun a rotation at Hialeah Hospital in their emergency room department. On my first day, 4 out of 5 of the patients that I saw were without insurance, and the 5th was severely underinsured. According to Milstead, in her book, Healthcare Policy, this phenomenon is not uncommon. Many Americans delay seeking treatment because of their inability to pay. This draws them into the ER, where they leave with maybe a Band-Aid and a prescription, but they also leave with an enormous bill that will, without a doubt, go unpaid. This bill becomes the debt of our society. A.R. Kovner believes it rests on our shoulders because, as he states in his book, Jonas and Kovner's Healthcare Delivery in the U.S., even with insurance, the average bill increases as societies, hospitals, and healthcare institutions try to recover the cost of the unpaid bills. There is no flawless scenario or perfect answer to this problem. Socializing medicine would cause an increase in taxes, which is why it's met with so much resistance. Higher taxes are a small sacrifice which would deliver exponential reward. On average, socialized medicine costs Americans $81 a month. This is compared to the $250 a month they spend in medical debt or high insurance premiums, according to Estes Harrington in her book, Healthcare Crisis. Imagine losing your job and coverage, which is stressful enough. Now you've become ill, and not only can you not work, but you have no means of seeking treatment. Singh points out in his book, Essentials of the U.S. Healthcare System, that in this situation, the individual easily becomes a debt to their community. Now imagine that, like public school, healthcare was essentially free. That you could walk in and out of a doctor's office or emergency room without having to take out a second mortgage. When we are empowered and able to seek appropriate care through proper venues, we can dissuade catastrophic and costly illness. Action must be taken. We cannot sit idly by thinking that this is not my problem. We must educate ourselves at the topic at hand. We must seek truth and not popular opinion. We must be willing to move forward, accept change, and work as a team. I ask you to take the first step with me and speak up. Advocate for healthcare for everyone, and for $81 a month, provide our community with the opportunity to live productive lives which are unburdened by debt or illness. Thank you.